I'm going to give you 10 things that every diabetic has to be doing, okay? Whether if they're in the protection phase, whether they're in the recovery phase, whether they're in the suffering phase, whatever phase you're in, the next 10 things that I talk about, every person has to do. You can kind of put it down on paper, you can kind of, review this a little later, but this is extremely important, okay? So let's break it down for you. The first thing that we're going to talk about is, if you're on medications, you have to take those medications, okay? You can't miss doses, you can't miss the timings, you have to take the medicines on time. If you're running out of stock, you know it's going to get over, please go reorder it, because there are a lot of patients who tell me, my medicine got over, so I started missing doses. That's not going to work, okay? Second thing is, if you have if you're on insulin, okay, if you've spoken to your doctor, you can alter the doses by 1 or 2 units to a maximum, okay? Anything over and above that, you have to be in touch with your doctor, all right? So that's the first point. Second point, no unnecessary supplements, okay? I have been saying this repeatedly. Please don't supplement, even if it's zinc, whether it's vitamin C, whether it's curcumin, doesn't matter. If you're self-supplementing, it can cause problems later, okay? So no self-supplementation. And one more thing, if you have been taking any supplement for more than maybe 4 or maximum 6 months at a stretch, zero break, okay, you need to review that supplement. If you started it yourself, you have to stop it, okay? And if it came from your doctor's side, then it's a good time to do a follow-up, okay? So please be extra careful about supplements. Now, when you talk about supplements, you have to mention about vitamin D and B12. Every diabetic has to have good levels of vitamin D and vitamin B12, all right? So if you don't have a chance to do your blood reports, that's okay, okay? But you have to understand vitamin D, you can go into the sun, you can, eat stuff, mushrooms and egg yolks and all, but you need at least 1,000 to 2,000 international units of vitamin D every day as maintenance dose, okay? When you talk about B12, there is a lot of neuropathy which diabetics suffer with, tingling and numbness in the fingers, a heaty feeling under the feet, like your feet is going to slip and all. So if you are one of those people, or even if you're not, your B12 levels also have to be optimum. Now, again, if you're not going to be able to check, you're a vegetarian, you're dairy free, you're having gut issues, probably it might be a good idea to supplement some amount of B12 also, okay? So vitamin D and B12, extremely important. So that's point number 2. Point number 3, monitor. Right now, awareness is key, okay? You have to know whether your sugars are going up. You have to know whether your sugars are going down, okay? So when I'm talking about monitoring, please don't obsess about numbers and start checking 5 times in a day, 4 times in a day. No, okay? Let me break it down for you. Anybody suffering from diabetes, look at a fasting blood sugar maybe once or maybe twice or maybe 3 times in a week, okay? If you're looking at a postprandial, post meals, you look at main meals, okay? So it's after breakfast, 2 hours after breakfast, after lunch, after dinner. It could be 1 or 2 times every week, okay? If you are on insulin, then it's a good idea to look at pre-meal sugars also, because it helps you alter your medications if required, okay? Now, if your numbers are looking good, they're looking better, start reducing the number of times you're checking it. Don't keep, checking it so many times. But if your numbers are not looking very good, then it's a good idea to increase the number of times you're checking, okay? If you have blood pressure, okay, it's a good idea to check your blood pressure at least once a week or once in 2 weeks. It's the same rule. If it's getting better, you can reduce the number of times you're checking. If it's getting worse, you have to increase the number of times you're checking, okay? If you don't have blood pressure, but you have diabetes 5 years, 10 years, at least check your blood pressure once in a month, maybe once in 2 months, okay? So sugars and blood pressure both need to be monitored. So that's point number 3. Point number 4, okay? Now, how you're going to remember this, I'm going to show it to you on the body, so that's easy to remember, okay? Point number 4 is your mind, okay? It starts from the mind, okay? Your mental health, okay? The amount of anxiety, amount of fear that is going on today, and amount of uncertainty, and especially I feel really bad because everything is it's kind of directed towards diabetics, the amount of misinformation that is there. So one thing I want to clear out today, just because you have diabetes doesn't mean you're going to get COVID, okay? And just because you have diabetes doesn't mean that your recovery is going to be really bad and you're going to have a really bad time with complications. No, it doesn't mean that. What happens is that if your sugars are uncontrolled, the numbers that I spoke about before, above 140, above 180, if your sugars are uncontrolled, you're doing nothing about it, it's been uncontrolled for a long period of time, then you can have, complications, then you can have a longer recovery time. Okay, so bottom line is, if you know this, if you just talk about reducing your sugar levels, keeping them under control, then obviously even if you get COVID, your recovery is actually going to be really good. Okay, honestly, today's talk, what I want to make you understand is that, one, don't fear. Okay, understand and do things for yourself. Okay, second thing is, it's okay even if you get it, but when you talk about immunity, it's about how you can actually recover faster also. Okay, the next few points that I'm going to talk about is predominantly, I'm talking about these things because I want you to avoid unnecessary infections. I want you to avoid unnecessary antibiotics. I want you to try and avoid unnecessary visits to the hospital, to diagnostic centers, and even clinics for that matter. Okay. So fourth is your mind. So anxiety. So when you talk about anxiety, fear, do something about it. You want to meditate a little bit, understand yourself, understand the environment around you. Okay. It's not conducive outside. So start helping yourself. All right. Then you go down to your eyes. Okay. Eye health is extremely important. You call it work from home, you call it school from home. The whole environment has changed today. So whether it's a young kid, whether it's a mom, whether it's a dad, whether anybody, an older individual, everybody is hooked onto gadgets now. Okay, Zoom calls and WhatsApp calls, and it's all about calls and gadgets now, videos and cooking videos and whatever it is. Okay, so if you're facing things like itchiness in the eyes, swelling around the eyes, headaches, blurring of vision, okay, dry eyes and all, please take a note of it immediately. Don't ignore it. All right, any diabetic facing these things has to be, there's redness in the eyes and all, please be careful. Okay, first thing you got to do is cut off your screen time. Start limiting the amount of screen time that you have. Okay, be very careful about that. Do a little bit of cold compression. Okay, if you're having spectacles, make sure you're wearing them. Okay, a lot of people, my mom-in-law will not wear her spectacles. Okay, so you have to wear it if you have a number. All right, if you have constant headaches, if your BP is under check, if you know you're not wearing your spectacles, probably it's a good idea to get it checked with your ophthal also. Okay, in fact, my aunt is an ophthal, and as a kid she taught me this. She said, you take this water in the palm of your hand, okay, fill it up, okay, and then you put your eye inside that and you blink. Okay, and that's one of the best cleanups that you can do for your eyes. Okay, so it's a good idea if you want to try that also. You have a lot of strain and all, it'll really help you. And last but not the least, a little bit of eye yoga, a little bit of exercise, look up, look down, diagonally, right, left. These things actually really help your eyes. Okay, then next is, from the eyes you go down to your mouth. Okay, now oral health. I cannot emphasize the importance of oral health when it comes to diabetes and when it comes to the gut health also. Okay, so things like bad breath, the teeth are getting loose, you have blisters in the mouth, you have ulcers in the mouth, bleeding gums, swelling in the gums. If you have any of these issues, you have to again make sure you're taking care of yourself. Okay, basic stuff. Brush your teeth twice a day. It's not only in the morning, but make sure you're brushing your teeth at night also. Okay, I remember as a child, my dentist used to tell me, if you have the opportunity, you brush after breakfast also, so that's a choice that you can make, but brushing at night is extremely important. Okay, make sure you're rinsing with plain water. You don't really need any gargles. With plain water after each and every meal. Okay, and if you do believe in the concept of oil pulling, please go ahead, just start with oil pulling first thing in the morning. That also helps a lot with oral health, but be very careful. Okay, you need to take care. Okay, from your oral health, you go down to your belly fat. When you talk about belly fat, just keep an eye open. If your stomach is looking bigger, the things are fitting a little tighter, there's a problem, start reviewing your lifestyle immediately. Are you sitting more? Are you walking less? Have you stopped exercising? Is your sleep not proper? Start reviewing that, because belly fat is not only about diabetes, it is about your triglycerides, it is about your fatty liver also. Okay, so be extra careful. Then you move on to your gut health. You cannot ignore your gut health. Acidity, constipation, excessive burping, indigestion, bloating, any of this happening, start reviewing what you changed. Okay, immediately. Lack of movement, being sedentary, sitting more is going to cause a lot of issues. Okay, then you talk about the ninth point, that is your feet. You have to be very careful about your feet. Any diabetic listening over there, please, you have to look at your feet, pamper your feet each and every day. Okay, when you cut your nails of your feet, of your toes, make sure you cut it horizontally. Okay, if you cut it in a U, then the chances of an ingrowth increases a lot. So you have to be very careful when you're cutting your nails. Okay, whenever you're putting your shoes, you make sure there are no pebbles or any hard objects inside. So you check with your hands first and then put your feet inside. last but not the least, there are lots that you can do, but what is most important is when you're talking about your feet, your footwear is extremely important. Okay, it's not only when you're going out for a walk, even when you're being indoors and walking inside. People like Akshat keep telling people, all the diabetics, please increase your movement inside the house. Okay, so your Hawaiian chappals and your rubber chappals are not going to be helpful at all. So you want to look at something like a floater or something which has a back strap or a little bit of back support or something, or your good old your sports shoes and all, which actually will help you a bit more, especially when you're going for a longer, like a 15-20 minute walk. Okay, so footwear, especially just when you're at home, also becomes extremely important. Okay, the 10th point, last but not the least, if you are convinced by now, please go ahead and vaccinate yourself. Okay, this is an extremely important point that I have to mention. If you've not done it, if you're convinced, then go ahead and do it. Okay.